Good afternoon, guys. I've decided to redo A for you. Now it's discussing biomarkers of Alzheimer's disease. Okay, how we test for them, and those kind of things. So let's dig into A for today, and then we will, if there is people who want to discuss things after the show, leave them in the chat below for me, please, and I will see if I can answer them for you. Okay, here we go with A. Title is What Biomarkers Can Tell Us After 80. Okay, here we go. When families talk about memory changes in someone who reached their 80s, the conversation often begins with a sigh. Maybe it's just aging. It's a comforting thought, a gentle explanation, a way to soften the fear that something deeper might be happening. But sometimes the brain is trying to tell us or tell a more specific story. This is where Alzheimer's biomarkers come in. Tiny, tiny biological signals that help us understand whether memory changes are part of normal aging or part of a disease that deserves attention, planning, and care. Meet Eleanor. Eleanor is 82. She still bakes the same lemon cookies she made for 40 years. She still remembers every neighbor's birthday. But lately, she has been repeating conversations and misplacing things. She swears she just sat down. Her daughter, Maria, wonders if this is simply the natural drift of getting older. After all, Eleanor still laughs easily. She still recognizes every face in family photos on her fridge. But during a visit with her doctor, Eleanor's family learns about biomarker testing, a way to look at proteins in the blood, spinal fluid, that can show whether Alzheimer's disease is quietly at work. The idea the idea the idea feels strange at first. Why test an 82-year-old? Isn't memory loss expected? The doctor explains gently. Age doesn't blur the biology. Even at 80 or 90, biomarkers can help us understand what's happening and what to do, what to expect. So Eleanor agrees. When biology gives clarity, a week later the results come back. Eleanor's biomarkers show a pattern often seen in Alzheimer's disease: higher levels of PTAU and lower levels of beta amyloid. It's not a diagnosis by itself, but it is sign, a sign that her memory changes aren't just aging, a sign that her family can prepare, plan, and support her with clear expectations. Maria feels a mix of relief and sadness. Relief because she finally understands what's happening. Sadness because the future feels more fragile now. But the doctor reminds her, knowing the truth helps us care better. It helps us protect what matters most. Meet Walter. Walter is a 89-year-old. He's lived through 2 wars, raised 5 children, and still insists on mowing his own lawn. His memory has slipped a bit. Names take longer. Stories get tangled, but he's still sharp in many ways. His family worries, but his biomarker tests come back negative for Alzheimer's disease. His memory changes are likely from small strokes and vascular changes, common in older adults. His clarity help his clarity helps his family focus on what will help him most: managing blood pressure, staying active, and keeping routines steady. Biomarkers didn't just predict decline, they distinguished causes, giving Walter's family a clearer path forward. What families should know: biomarkers don't take away hope, they give families a clear picture of what's happening. They help separate normal aging from disease. This matters for planning, safety, and emotional preparation. They guide care. Knowing whether Alzheimer's biology is present helps clinicians tailor support. They reduce uncertainty. Families often feel less anxious when they understand the why behind memory changes. A gentle truth for families: the hardest part of memory loss is not always the symptoms, it's the uncertainty. Biomarkers don't solve everything, but they replace fear with understanding. They help families make decisions with clarity rather than guesswork. And for someone in their 80s or 90s, that clarity is a gift. It honors their story, it respects their dignity, it helps their family Walk with them, not behind the fog, but beside them. Biomarkers don't just illuminate the biology of Alzheimer's, they expose the quiet pervasive, pervasive ageism that has long shaped how we interpret memory loss in people over 80. This essay traces how science is finally correcting a cultural blind spot. When biology confronts bias, a narrative on biomarker and ageism. In clinic rooms across the country, the oldest patients often arrive carrying decades of stories, marriages, migrations, war losses, reinterventions. Their lives are long and textured, but when their memory begins to fray, the world too often shrinks. Their experience into a single dismissive phrase. Well, at that age, ageism is subtle. In medicine, it rarely announces itself. It shows up in the quiet assumptions, the shrug when an 82-year-old forgets a name, the hesitation to older tests, the, the hesitation to order tests, the belief that precision doesn't matter because they are old. It shows up in ways that families are told to expect decline, as though aging itself is a diagnosis. But biology has begun to argue back. The moment biomarkers changed the story, a woman in her late 80s, let's call her Ruth, came to clinic with her daughter, who noticed she was repeating questions and losing track of conversations. Ruth still cooked, still read the newspaper, still remembered the names of her grandchildren, but something was shifting. Her primary doctor had waved it off. She's 80. This is normal. But her daughter insisted on fuller evaluation. When Ruth's spinal fluid came back, showing elevated PTAU 818 or 181 and reduced AB42, the pattern one second, guys. Paper. was unmistakable. Alzheimer's biology was present, not vaguely, not ambiguously, but clearly. The biomarker results didn't just clarify Ruth's diagnosis, they revealed the assumption that had almost her prevented her from receiving one. Ageism had spoken first. Biology spoke louder. Why ageism persists in dementia care. Ageism thrives in spaces where complexity overwhelms certainty. People over 80 often have vascular disease, arthritis, hearing loss, frailty, grief, and decades of accumulated medical history. Symptoms blur, diagnoses overlap. Clinicians worry about burdening patients with tests or causing distress. So the path of least resistance becomes the path of least accuracy. But the saint, er, but but the Saint PA or PAU Research Institute's work and similar studies show that biomarkers retain their predictive power even in the old. They distinguish Alzheimer's from vascular cognitive impairment, mixed dementia, and age related decline. They forecast progression. They help families plan. Ageism says it's just aging. Biomarkers say no, something specific is happening here. The symptoms, or the human cost of dismissing symptoms. When we assume memory loss is inevitable, we rob people of clarity. We deny families the chance to prepare. We delay safety planning. We miss opportunities for treatment. And we send a quiet message to older adults. Your suffering or your suffering is expected. Your confusion is ordinary. Your identity is negotiable. But aging is not a diagnosis, and dementia is not a foregone conclusion. The oldest patients deserve the same precision, the same curiosity, the same respect for for their lived experiences as anyone else. Biomarkers as instruments of dignity. The power of biomarkers in people over 80 is not just scientific, it's moral. They restore specificity where ageism has created vagueness. They give families language where silence has created fear. They allow clinicians to say Not just what, not just that something is happening, but what and why. In Ruth's case, the biomarker result changed the trajectory of her care. Her daughter understood what to expect. Her clinician adjusted medications. Her home environment was made safer. Her future was no longer a fog, it had contours. A new way forward. If we listen closely, biomarkers are teaching us something profound. Precision is not wasted on the oldest patients, it is owed to them. Ageism collapses individuality, biomarkers restore it. Ageism shrugs at decline, biomarkers map its path. Ageism assumes, biomarkers reveal. The science is clear. The question is now whether our systems, our clinicians, and our culture will catch up. Whether we will finally treat the cognitive health of people over 80 not as inevitability, but as a story worth understanding. Okay, guys, that is A for you. I will be on with B shortly. Give me a bit for that, please, and I'll be on with that for you as soon as I get it together. For now, Gator Wellness, take care, folks.